World Malaria Day, annual observance held on April 25th to raise awareness of the global effort to control and ultimately eradicate malaria. Malaria is a serious and sometimes fatal mosquito-borne infectious disease. It is transmitted to human through the bite of infected female mosquitoes. Malaria symptoms typically include fever, chills, headache, muscle ache, and footage. World Malaria Day is to raise awareness about malaria and to mobilize efforts to control and eliminate the disease. It was established by the World Health Organization in 2007 to highlight the global burden of malaria and to promote actions to prevent and control the disease. World Malaria Day is an occasion to highlight the need for continued investment and sustained commitment for malaria prevention and control. National Vector-Borne Disease Control Program (NVBDCP) is a key national health program being implemented in Tripura since inception with a goal to prevention and control of malaria. Inspired Malaria Elimination Program 2, it is targeted to eliminate malaria by 2027. Tripura state is working for malaria elimination within the stipulated time frame as per the National Strategic Plan 2023 to 2027, and many steps have already been adopted. Malaria has been a challenge for this state due to several malaria epidemic pockets in few districts like Dalai, North Tripura and Rugui. Being a local and focal disease, the malaria cases is being closely observed through a robust mechanism of supervision and monitoring starting from the sub-center level to district level officials attached to the program. To prevent and control of malaria, few steps have been taken by the state government. Strengthened active and passive surveillance, ensured early diagnosis and complete treatment with proper follow, home-based treatment by the accredited social health activists, community health worker, strengthened supply chain management, trained all accredited social health activists, multi-purpose workers and medical officers in a phased manner. School awareness program. Due to focused intervention malaria testing, substantial decrease in death due to malaria has also been noticed. Though recent increase in malaria cases is a challenge, but the state has moved forward from the times of 84 deaths in 2014 to only 1 death in 2023. It has been made sure that all logistics, including the drug and dietary kits, reach up to the accredited social health activists in an uninterrupted manner. In addition to the grants under the global grant for AIDS, TB, malaria eradication through National Health Mission. The State Health Department is also making necessary contribution, especially with the injectable drugs for treatment of severe and complicated malaria. The 118 primary health centers are ensuring that the microscopic diagnosis of malaria parasite with the support of quality assurance by state and regional quality assurance laboratory. The malaria centennial site hospitals are contributing to the treatment of severe and complicated malaria. In the most vulnerable situations, including pregnant women, infants, children under 5 years of age, refugees, migrants, internally displaced people, and indigenous peoples continue to be disproportionately impacted. Malaria exists in more than 100 countries worldwide, and some 9 lakh people die from the disease each year. However, malaria is preventable with the use of medicines and other precautionary measures, such as insecticide, treated bed nets, and indoor insecticide spraying. Let us accelerate the fight against malaria for a more equitable world through. For prevention of malaria, contribution of all sectors, all departments like Public Works Department, Rural Development, Agriculture, Education, Panchayat, Meteorological Department, Armed Forces, Science and Technology need to contribute keeping malaria elimination as a priority goal to achieve with developing broad-based intersectorial convergence with all sectors through general administration. The state will move forward towards elimination of malaria from Tripura. Friends, have taken some departments: Public Works Departments, Rural Development, Agriculture, Education, Panchayat, and Science and Technology. All departments has to work to eradicate malaria totally. One thing is, malaria is a disease, so we have to first eliminate the mosquitoes. So we have to identify the areas prominently where it breeds. So we have to control, taking confidence and support from the government departments. Where municipalities and gram panchayats are there, we have to constantly identify the places where the water loggings are there, and we have to see that it should be taken care of by the municipalities and gram panchayats. And in the same way, the science, they have to research how best they can control. These mosquitoes, not only in human, it is also a problem for animal husbandry also. We see where there is a mosquito problem in cattle sheds or buffalo sheds, they give, at the time of more mosquitoes, they give less yielding of milk. So this has to be tackled by them, how to eradicate them. Cleaning and keeping the place dry is one of the things, and simultaneously how best we can put, and we can control that one. And second, the education department, they have to educate the people. Science people, they are developing. So once they develop the ointment, that ointment, for some people it become allergy. Then they stop putting ointment. Then again they brought coils. So when they coil injection, and again also it is becoming a problem for some people, allergy. So they stopped that thing. So now this electrical bags has come. Even that also is creating a problem for some people. So we have to continuously research on this, and we have to come with modern. So how to control this mosquito problem? Basically breeding area and controlling area, and later medical side. How best we have to do this medical problem. In good old days, when I was a kid, at that time it was more in rural area. But from that stage now control has come, best medicines have come, and doctors also got familiar with the disease. And I can say that National Health Mission, when I thought of medical health mission only for TB, I thought only for TB so much of staff is there, district wise, block wise, village wise, and primary health center wise. But later I came to know that it is not only the TB, it is also AIDS, TB, malaria, and chronic diseases what are there. They have to maintain a record, they have to keep every patient, and they should see that patients will not be there, and it is continuity should be stopped. So basically in a long range, this National Health Mission's role is more. Doctors, they will give regular treatment, but in a long range, the National Health Mission's responsibility is more. So keeping that in view, the staff and department, they will take all steps. This is my impression, and we have to see that Tripura is one of the major problem of AIDS also. So keeping that in view, AIDS and in parts of this malaria problem, we have to tackle properly, and as we put target for eradication by 2027, we should see that we will achieve totally before that day. Thank you.